Patrick Arnold was a chemist, trained at the University of New Hampshire, passionate about steroids, and extraordinarily creative. By the late 1990s, he had already transformed the American supplement market by introducing Gestrinone, Andro, the testosterone precursor famously found in Mark McGuire's locker. He understood how anabolic molecules work better than almost anyone outside of pharmaceutical R&D. And he understood something else. Drug tests don't detect everything. They detect what scientists already know to look for. Anti-doping labs maintain reference databases of known banned compounds and their metabolites. Mass spectrometers are programmed to hunt for specific molecular signatures. But what if you made a molecule that had never existed before? Arnold went digging through the scientific literature of the 1960s and 70s, a golden age of steroid pharmacology, when dozens of synthetic androgens were developed and then abandoned. Failed contraceptives, discontinued treatments, molecules that worked, sometimes too well, and were shelved for commercial or safety reasons, never marketed, never scheduled, never entered into any anti-doping database. One compound caught his attention, Gestrinone, developed as a contraceptive and a treatment for endometriosis. Gestrinone had a distinctive feature, a triple bond, a carbon-carbon alkyne in its 17-alpha position. Arnold saw opportunity. He knew that triple bonds could be chemically reduced. By exposing gestrinone to molecular hydrogen in the presence of a palladium metal catalyst, a reaction called catalytic hydrogenation, Arnold converted the triple bond to a single bond, adding 2 hydrogen atoms to the molecule, and creating a compound that had never existed in nature, never appeared in any lab's database, and was invisible to every drug test on the planet. He called it tetrahydrogestrinone. USAID and the athletes called it the clear. And here is why it was so extraordinary. First, binding. THG binds to the human androgen receptor with even higher affinity than testosterone itself. It activates muscle-building pathways more powerfully than the body's own hormone. Second, administration. Dissolved in oil, it was placed under the tongue. Sublingual absorption bypasses the liver entirely. No first-pass metabolism, no metabolite fingerprints, fewer traces in urine. Third, novelty. Because it had never been documented, no test could find it. It was the perfect crime, as long as nobody reversed the chemistry.